Hello and good morning. I'm Dr. Sanchez. I'm a third-year surgery resident, and today I'm going to be answering some of your questions. So I get a ton of questions across all platforms, on TikTok, a lot on Instagram, and they're about all sorts of things. And I haven't really done a video where I just sit down and answer questions. So I thought now would be a good time. I went on Instagram and I actually did a little poll and asked people to just submit all the questions that they might have about my life as a surgery resident or my life in general or really anything that comes to mind. And so today I'm going to be going through those questions and answering them all. Everything is fair game. I was feeling like I needed to wear my white coat for this video. And then I decided that I don't really want to. I wear it every day anyway, so might as well take a break. Plus I'm wearing this shirt that says, "Wonderful things are about to happen," so I like that. Intermission as I look for the questions. Found them. Okay. Now let's zoom out. So here's what I posted on my story, and I'm gonna be going through some of the questions. Okay, the first question was, why are anesthesiologists always so hot? This was an anesthesiologist that asked this. One of the best anesthesiologists at the hospital, but that's fine. Is it stressful? Yes, the answer is yes. I feel like there's a fair amount of stress associated with becoming a surgeon and the entire process, but I think everybody has different ways of coping with stress, and you kind of learn what works best for you and you do those things, because otherwise you'd absolutely lose your mind. How do you manage to find time to work out and do things outside of the hospital? I just take every bit of time that I can get. Not everybody does that. Some people just, want to get some rest, and that's totally okay. Some days I just want to get some rest, but I try to make the most of every second of free time that I have. So when I get off early, I'll go to the gym, hang out with my daughter, I'll do whatever things need to be done. I don't know, I've always liked being busy, so I feel like it works for me. Open heart surgery is now better compared to 10 years ago. I think most things are better now. There are very few specialties that haven't evolved in the last 10 years. A lot of things have changed. There are places that are even doing minimally invasive heart surgery. Now, I can't really speak on that because I've never personally seen it done, but I know it's out there. People are doing it. And nowadays, there's a lot of endovascular procedures. So there's a lot of things that are being done in a minimally invasive way that back in the day would have been, completely open surgery. How did you know it was something you wanted to do? So I didn't. I actually spent all of my life, or most of my life, saying I would be anything but a doctor. If anybody knows me, they knew I wanted to be a fashion designer, an interior designer, a hairstylist, a makeup artist, which I did. I got my cosmetology license while I was in high school. But I pretty much always said I would be anything but a doctor. I think I just had a very skewed view of what doctors were. I think for my entire life, I knew I was a little more on the creative side, and I knew I wanted to do creative things, and for some reason in my mind, doctors didn't fall into that category. Now that has changed a lot. I think there are a lot of doctors that are creative in many ways. I also think that a lot of it was because I didn't see someone that looked like me or acted like me, or I felt really represented me in the field of medicine. Surgery obviously has become more female dominant over the years, but even then, a lot of times as a female in surgery, you're expected to kind of fit in this little box, and there's not a lot of room in that little box. And so I think that's that's changing over time, and I'm super excited to be a part of that. But I think that's why I didn't know early on. It wasn't until I really started college and somehow ended up shadowing a surgeon that I fell in love with it. It was literally from like one day to another. I was like, all right, I think I want to do surgery. Like, I went into medical school knowing I wanted to do surgery. How nerve-wracking is surgery residency? I've only had a couple breakdowns, like complete breakdowns, only a few, a handful, I would say. I think that's pretty good. How many study hours do I put in a week? So It depends. There are weeks where I study more, obviously weeks where I study less. A lot of it's dictated by the rotation that I'm on. So right now I'm on vascular surgery. It's a little bit more demanding. I've had a lot more, longer days where I'm getting off at like 10, 11 p.m. And if I'm getting off at that time, honestly, sometimes I just get home, I shower, I eat some dinner, and then I go to sleep. And there's not much time for studying at night. That being said, I've always been a big proponent for studying throughout the day. Especially with this kind of lifestyle, it's nice in theory to sit in your office and set everything up and study and have dedicated study time, but sometimes that's not realistic for me and what I do on a day-to-day basis. And so I always have my phone with me, that's for sure. And so one of the things that I like to do is just do questions on my phone or do flashcards or do a little quick review whenever I have some downtime. So, ¿en qué nivel de residencia vas? Which means what point in my residency am I? I'm in my 3rd year of residency. Voy en el tercer año de residencia. Me faltan 2 para graduarme como cirujana general. Bueno, asumiendo que pase todos los exámenes. Y luego después tengo la opción de hacer un fellowship. Probablemente yo creo que sí voy a hacer. How often do you really get time to spend with your daughter? Every day, pretty much, to be honest. I spend time with her every day. I try to hang out with her when I get home. Like, we'll play in her little playroom, we'll go outside, I pretty much let her dictate whatever she wants to do. And I try to give her, like, dedicated time. Like, really pay attention to her when I'm with her because our time is limited. So I try to make the most out of that time that I have with her. That being said, there are some days where I get off late and I don't get to see her before she goes to sleep. And that just sucks. When you're finished, will you stay living where you are now or would you want to move? I don't know. I kind of like the South Florida area, not gonna lie. I think if I were to move, this is gonna sound really, I feel like I'm gonna get a lot of judgment for this, but the other place that I would consider moving would be LA. I was born in California, so I would love to go back to California. Maybe not, smack dab in the middle of LA, but around that area. I like being near a big city. I also wouldn't be opposed to ever going back to Charleston, South Carolina. It's more of a chill place, so I think that's somewhere where I would end up maybe later in life, but I love Charleston. It's a beautiful city. Do I regret stepping into the surgical field? That's a loaded question. I definitely don't regret it. I enjoy it. I love surgery. I love the patients. Do I love the process of becoming a surgeon necessarily? No. I've had a good experience. I don't have bad things to say overall. I think it's been great. I think it's just a difficult process altogether. It doesn't matter where you do residency. It doesn't matter where you do medical school. It's gonna be hard. Do you guys really hear music in surgery? Yes, we do. We listen to music during surgery. There's a variety of themes. There's, you can listen to pretty much anything. Some surgeons choose not to listen to any music. It's pretty much surgeon preference. So anesthesia sometimes dictates the music. I've listened to pretty much everything. I've listened to Disney soundtracks. Like, there was a transplant surgeon who really liked listening to like the Frozen soundtrack. Then there's a cardiac surgeon that listened to strictly like reggaeton in the OR. I was all about that. Like cardiac surgery and reggaeton, like hell yes. And then, I don't know, like classical music. You have some that listen to like a little bit of rock. I still have yet to see a surgeon that listens to banda. I feel like that would be me. I would feel at home if we could just listen to banda, like some Grupo Firme, some Chente, like in the OR, I would be set for life. That's gonna be me in a few years. Am I planning to do a fellowship? I am planning to do a fellowship. I'm not gonna say what yet because, to be honest, I haven't fully made up my mind. I flip-flop between two things that I really, really love, but I don't know. Oh, what's the general time commitment of residency on a day-to-day basis? Well, this is so variable. I've done 18-hour days. I've done 24-hour shifts. The max amount of time that you are allowed to work per the ACGME is 28 hours. So after 28 hours, you basically have to get a break. It's not like back in the day where you could just work endless hours and no one cared. Now there are rules. Whether all residencies follow them, that's up for debate. Who knows? Hardest part about surgery residency. Ooh. You know, I will say it's not the workload. It is not the workload. I think the hardest part about surgery residency has been maintaining a positive attitude. Obviously, some of that is due to the fact that there are difficult personalities. People that tend to go into surgery have strong personalities. They tend to want to have things their way. That also goes for most of the people in the OR. People that work in the operating room are not typically your, very shy, easygoing person. There are some exceptions. I've met some amazing people that work in the OR, but you have a lot of very strong personalities that you're working with constantly. So that can be a challenge in itself. Also, you're dealing with stressful situations, and not everybody knows how to deal with a stressful situation and turn it into a positive thing. Not everybody knows how to deal with a stressful situation and not take out their anger or frustration on other people. And so I think that's been the hardest challenge for me, is that I don't want to come out of residency bitter. Like, it's hard. I chose this, and I know it sucks at times, but I want to come out of residency and be the same person not the same person that I was going in, but like have that same positive, optimistic outlook on life that I had going into it. God. You are fully capable to just do OnlyFans. What pushes you to do residency? Very impressed, by the way. I don't know what to make of this. I think they were like not being rude, genuinely. I guess they're asking what pushes me to do residency when I could rely solely on my looks to make a career. Hey, I do not knock anybody who is relying on their looks to make a career. I'm pursuing surgery because I love it. I'm pursuing this career because I feel like I truly have a passion for it. I've always enjoyed working with my hands. I think it's a talent that I have, that God gave me, and so I intend on using it to the best of my abilities. How do I study? Study tips, please. So my study technique has evolved greatly over the years. I used to be one of those people who thought that I could just sit there. Well, number one, I had no study habits when I went to college. Let's be clear about that. I graduated high school with no study habits because high school was easy. I could just get good grades without trying. I don't know. And then I started college, and that was a little bit of a wake-up call. I started having to study. My study technique still sucked, if I'm being honest. I usually studied about 3 to 4 days before an exam, if that. Sometimes it was 1 or 2 days of cramming, and I was usually able to do well. And then medical school came along. Oh, what a wake-up call that was. Medical school was really hard. And you cannot study 2 days before and expect to do well on an exam. I realized that pretty quickly. And so I tried everything. I realized that the way that I learn best is by doing things, talking about things. I'm very hands-on. I like having a discussion. Kind of my techniques for studying for like APSI, which is our yearly in-service exam, are mostly consist of me watching videos. There's a lot of videos online that are really good. Listening to podcasts. I'm an auditory learner for sure. Doing flashcards. I tend to kind of make my own deck. I like to make flashcards of things that I tend to forget. So I don't make flashcards of everything because I would just never finish. I make flashcards of the things that I feel like I forget very often, and those are the things that I review more. And then finally, just doing questions. Doing questions is very important for medical training because you're always going to be taking standardized exams. And one of the key things about standardized exams is that you need to figure out how they are going to ask you the questions. You might know the material, but if you do not know it in the way that they need you to know it, you're going to miss it on the exam. So when did you know that you wanted to match into surgery as opposed to other specialties? On average, how many hours do you work? Per week, I would say around 80. I mean, we're on an 80-hour cap, so the ACGME guidelines say that you are not supposed to work more than 80 hours. There is a loophole in that. That is averaged over, I believe, 4 weeks. So you can work 90 hours 1 week as long as the following week you work 70, or you, over the 4 weeks, are able to average out to 80. Is it worth it? Yes, I would say yes. Mind you, I'm only in my 3rd year, so maybe ask me once I'm done. What does a typical week look like for you? So I actually posted a video on it. I think I did a week in colorectal surgery. It's on my YouTube channel, one of my other videos. Right now I'm on vascular surgery. So I work typically every other weekend. So if I'm on for that whole week, a week for me looks like me working Monday through Friday. I get up around 5 in the morning. I'm usually at the hospital around 5:30 to 6 a.m. I see all the patients. I put in any orders. I talk to all the attendings. There's 3 on this service, so I touch base with all of them. There's also a nurse practitioner who's awesome. I touch base with him and just kind of, you know, discuss anything that's pending or just give him updates on patients. And I go to the operating room. Our cases typically start between 7:30, 8 a.m. or so. I'll be in the operating room all day until whatever time we finish. I see consults throughout the day, and then once I get off, that can vary a lot. Anytime from like 5 p.m. to like 11 p.m. or midnight. And then once I get off, I try to run over to the gym. I get home, I see my daughter, I go to sleep, I do it again the next day. On the weekends, if I'm on, I come in, I round on all the patients, I do any cases that need to be done, see any consults, and then usually go home a little bit earlier, but it varies a lot. And then I'll be on call, so anything that comes in, I do have to come in and see. Since I'm on kind of a weekend on, weekend off schedule, I basically work 2 weeks straight, and then I'll have 2 days off. So Saturday, Sunday, and then I work another 2 weeks straight. What are the majority of cases that come in? Oh, that, again, that's so variable depending on the specialty, but right now on vascular surgery, I would say we have a lot of access cases, so a lot of like AV fistulas, AV grafts, patients that, you know, we're familiar with, and we have, you know, the occasional AAA that comes in. We have had a lot of cold legs lately, meaning what I mean by cold leg is we've had a lot of patients come in with ischemia of their lower extremities, so they're not getting enough blood flow to the foot or the leg, and that's an emergency. You have to take them to the operating room. The goal is to restore the blood flow to their leg so that they don't end up losing their leg. For some reason, we've had a lot of those lately. Do you ever deal with imposter syndrome, and how do you cope with it? So yes, I think most of us in medicine deal with imposter syndrome, especially as you kind of go through the process of becoming a surgeon and you realize how much there is that you do not know. Like, medicine is so incredibly just beyond anything we will ever be able to fully understand. And it's good to realize that. So I think there are times where I feel like, holy crap, how did I even get here? And who allowed me to do this? And who allowed all of us to do this? Like, we are human beings cutting other people open, operating on other people, you know, potentially risking their lives in order to provide them some sort of benefit. And so I do feel like I've had times where I deal with imposter syndrome. The way that I cope with it is that I just constantly remind myself that I have prepared myself to get to this moment. So if I'm going to scrub into a surgery, I always know that I have done my part. I have done my reading. I have, you know, done everything that I needed to do to prepare for this case. And so, you know, yes, I am a human being, but I also have the skill set to take part in this patient's care. What age were you when you started your surgery residency, and how did you juggle it? I was 25 and now I'm 28, which is very sad because I feel super old. It's not sad, actually. I want to live to be like 95. So we got a while to go. Okay, so I think that kind of wraps it up for today. Thank you so much for watching, for sending me these questions. Hopefully I answered them to the best of my abilities. I really appreciate you guys being here, and I will be doing more of these in the future, so look out on my Instagram. I'll be posting kind of what questions do you have, and I will do my best to answer them all.